As the Mpox virus spreads rapidly across Africa, many are left wondering how to protect their families. As Christians, we can take both practical and spiritual steps to ensure our loved ones stay safe during this global health crisis. Mpox outbreak declared a global health emergency. What you need to know. On Wednesday, the World Health Organization, WHO, officially declared the ongoing Mpox outbreak in Africa a global health emergency. This decision comes amid growing concerns about the rapid spread of a deadlier strain of the virus, known as Clade Ib, in several African countries that had not previously reported cases. The strain, which was once limited to the Democratic Republic of Congo, DRC, has now spread to 4 additional countries, raising alarm among global health officials. Understanding the Mpox virus. Mpox, formerly referred to as monkeypox, is a viral infection that can cause a painful rash, fever, swollen lymph nodes, and other flu-like symptoms. The virus is primarily spread through close physical contact, including touching, kissing, or sexual activity. Contaminated materials such as bedding, clothing, or needles can also transmit the virus. Mpox is divided into 2 genetic clades, clade Y and clade 2. While clade 2 was responsible for the 2022 outbreak that spread across Europe and North America, clade Ib is now causing significant concern due to its higher severity and mortality rate. Why the WHO declaration matters. The WHO's declaration of a public health emergency of international concern, PHEIC, is the highest level of alarm under international health regulations. This status is reserved for extraordinary events that pose a public health risk to other countries through the international spread of disease. The declaration underscores the severity of the situation and the urgent need for a coordinated global response. Dr. Tedros Adhanom Ghebreyesus, WHO's Director General, emphasized the importance of recognizing the threat posed by the new clade of Mpox. The detection and rapid spread of a new clade of Mpox in eastern DRC and neighboring countries is very worrying, he said. The situation constitutes a public health emergency of international concern. The growing impact in Africa. Since the start of 2024, over 17,000 Mpox cases and more than 500 deaths have been reported across 13 African countries. The majority of these cases, over 14,000, have occurred in the DRC. This outbreak has been classified as a very high-risk event by the Africa Centers for Disease Control and Prevention, which has also declared the situation a public health emergency of continental security. The spread of the virus to new regions within Africa is particularly concerning, as it indicates that the outbreak is far from contained. Experts warn that the actual number of cases may be much higher than reported due to underdiagnosis and limited access to health care in affected areas. The international response. In response to the escalating crisis, the WHO has initiated the emergency use listing process for Mpox vaccines and has developed a regional response plan requiring $15 million in funding. 500,000 doses of the vaccine are currently available, with the potential for an additional 2.4 million doses by the end of the year. The DRC and Nigeria will be among the first countries to receive these vaccines. However, vaccines alone are not enough. WHO officials have stressed the need for a multifaceted approach to contain the outbreak, including increased surveillance, diagnostics, and research to better understand clade IB and its transmission patterns. What you can do. As the global community rallies to address this public health emergency, it's crucial to stay informed about the latest developments. If you are in an area at risk or have been exposed to the virus, seek medical advice and consider vaccination if recommended by health authorities. The Mpox outbreak serves as a stark reminder of the importance of global cooperation in addressing infectious diseases. By working together, we can help contain the spread of the virus and protect vulnerable populations. Stay tuned for more updates on this evolving situation, and don't forget to share this video to raise awareness about the Mpox outbreak and the steps being taken to combat it. Do not think that it is not in your country, so you do not have to take precautions. Remember, that is what we all believed when we heard about COVID-19. We all saw how quickly it spread throughout the world. So please let us prepare and be cautious. Practical steps. Follow health guidelines. Stay informed about the latest guidelines from health authorities like the WHO and local health departments. These may include recommendations on hygiene, social distancing, and vaccination. Practice good hygiene by washing hands frequently with soap and water, avoiding close contact with those who are sick, and disinfecting commonly touched surfaces. Get vaccinated. If you or your family members are at risk, consider getting vaccinated against Mpox. Vaccination can be an effective way to prevent the spread of the virus and protect your loved ones. Educate and support your community. Share accurate information about Mpox with your church and community to prevent misinformation and fear. Encourage others to take preventive measures and support those who may be affected by the virus. Prepare and plan. Develop a family plan in case someone in your household becomes ill. Ensure you have necessary supplies, including masks, hand sanitizer, and over-the-counter medications to care for sick family members while minimizing the risk of spreading the virus. Spiritual steps. Pray for protection and healing. Prayer is a powerful tool. Pray for protection over your family, friends, and community. Pray for healing for those who are affected by Mpox and for wisdom for healthcare workers and leaders who are responding to the crisis. Trust in God's sovereignty. In times of uncertainty, it's important to trust in God's plan. Remember that God is in control. Even in the midst of a pandemic, lean on your faith to find peace and assurance that He is with you. Show compassion and care. As Christians, we are called to love our neighbors, reach out to those who may be struggling or isolated due to the virus, offer help whether through prayer, delivering supplies, or simply providing a listening ear. Strengthen your faith community. Stay connected with your church and faith community, even if it's through virtual means. Participate in online services, Bible studies, and prayer groups to maintain spiritual support and fellowship. Conclusion. Combining practical precautions with a strong spiritual foundation can help protect you and your family during this Mpox outbreak. By staying informed, taking preventive measures, and trusting in God, we can navigate this challenging time with faith and resilience. Please like share, and subscribe to our channel.